Hi, my name is Lizzie Lee. I'm a PGY1 here at Mercy St. Rita's, Lima, Ohio, Emergency Medicine Residency Program. I'm here today and speaking with my program director, Dr. David Toro, and we're going to be answering some questions in regarding to what he looks for in an EM applicant.
Hello, I'm David Toro. I'm the Residency Program Director here at St. Rita's. We'll be happy to answer all these questions today and many questions in the future. What you see behind us is not a virtual background, that is a real live image of our beautiful hospital.
All right, let's delve into it, Dr. Toro. First question, what makes an applicant stand out?
Okay, so that goes along really well with what our program looks for. We are a new program. We are on our second residency class this year in 2021. So we look for people who are not afraid to innovate and to try some new things. You may be the first one going to any rotation or the second one in this year. So we want people who are not afraid of being the first and being leaders and being the first ones to be there.
All right, perfect. Do we have a minimum step score for our program, or what about low step scores? If they do have a low step score, what next do you look in an applicant?
So that's an important question. We don't have a minimum lowest or highest score. We really want to look at the entire application and look at you as a person. We consider your entire profile, not just your score. So in that regard, we look at all the applications the same to make sure we find the best people to come and train here at St. Rita's.
Do you care if someone retakes a class, if they had to repeat in remedial something? Does that matter to you?
It's important to look at the entire profile, right? Why did that person fail a course? Why did that happen, right? There may be a very good reason for it, and knowing that reason is important when you interview with us or when you send us your application. So it's not that much the fact that it happened, it's how you overcame that difficulty and how is that bringing you here today.
And does that same concept apply for gap years as well?
Correct. Everybody's story is different, so knowing why that gap year happened and what did you do with that time, it's an important part of your application that may even make your application better than other people because it would bring more experiences.
Perfect. And so we all know that step one is becoming pass-fail soon. How do you feel like that will affect how you look at an applicant?
In particular here for us at St. Rita's, and we look at the entire application. So you want to pass that test. You don't want to fail any of the USMLE exams or complex exams. But that won't affect much how we consider your application. For us, the most important thing is how you did on your clinical aspect of your training. So knowing how you did on your step 2 CK or complex 2, how you did on your clinical rotations as well.
So that kind of ties into my next question. So I know some applicants only have their step 1 score and they don't have their step 2 back yet. So if step 1 is pass-fail, would we really be relying on that step 2?
Right. The best advice I can give you with this is do your best. Try to have the most complete application at the moment you send it. If you're missing a piece of information in the application, it's not a big deal as long as you update the program after the fact when you get the results. But in general, you want to have the most complete application at the moment you send.
Perfect. And then, so I know we have some MD applicants as well as DO applicants. Do you feel like when you're looking at an application, the step scores are equivalent to the complex scores, or would you prefer a DO applicant to also have step as well?
That's individual to every application. I think if you do well on complex or on USMLE, you did well, right? If you did poorly on either one, it would be equivalent. The most important is what's your entire profile, right? Did you do well on your schooling? Did you get good grades on your rotations? Do you have good comments on your MSPE rather than just if you took complex or USMLE? Within our resident group, we have both MDs, DOs, and foreign medical graduates as well. So we consider all applications we receive to have the best kind of residents we could have here at St. Rita's.
Perfect. And I guess my question is, does having step 3 give you an upper hand? If you just already went ahead and completed that?
So to take step 3, one thing you have to have in mind is that you have to have finished medical school, or come from a different country and have finished medical school. So not necessarily. If you're in that situation, if you're a foreign medical graduate, or you finished medical school and didn't here in the US and didn't start residency right away, that may be an important piece of information to have. With that said, do well. Get the highest score you can on step 3, because getting a lower score, even though your result is done, wouldn't look well in your application. In that case, it may be better not to have it. But in general, you want to do well and have the most complete application you can.
Okay, so piggybacking on the fact that if you're a foreign grad or an IMG that finished off cycle, if you see an applicant is an IMG, what factors in their application do you look for the most, aside from having a high STEP score?
Good. That's something that we not only look on the applications for foreign graduates, but also for US seniors and US graduates. We look for your experience. Do you have leadership experience? Do you have research experience? How are your grades? How are your letters of recommendation? So it's more of what's the entire big picture of your application showing, rather than just a single piece of information.
Perfect. That perfectly ties into the application itself, okay? So personal statement, what do you look for? Should they talk about why they chose EM, or should they talk about more personal experiences? I guess, what do you think is important for the personal statement?
So consider this. When a faculty member reads your application, they will likely be reading 200, 300, 500 more applications. More so for a program director, we will read 1,000 applications or more. So you want to make sure your application looks different and stands out. You don't have to repeat your entire CV, your personal statement, because you will already be sending us your CV. So mention what do you like about EM. Mention what are your career goals. What do you want to do in the future after residency? Or how do you want to tailor your education to get to that goal? And tell us about you. Tell us about you as a person, and how you're different from other applicants.
Is research necessary for EM, and how heavily weighted is research?
That is a topic that's maybe a little different for every residency program, and goes along with the approach of the program director and approach of the individual programs through your training. Some programs will be more research heavy, some less. In general, the more you have, the better. But if you do have some research experience, it's more meaningful if there's some significant research, significant publication. So, other than that, it's more of you have some experience or not, or do we have to teach you to get you that experience versus you already have done it in the past. So it's not a sine qua non, you don't have to have it, but if you have it, make sure it's something that can help you highlight your application.
Okay, so does the research have to be EM related, or can it be just something that they're passionate about and they can talk about during interviews?
You can put this in a hierarchy of things, right? So landmark study in emergency medicine would be more significant than non-landmark study in emergency medicine, right? Having research experience versus having publication in emergency medicine. You can put that and organize them in different categories. Some is better than none,
Yeah.
but you can see how you highlight that on your application.
Okay, perfect. What about extracurriculars or volunteer? How do you weigh that, or how do you, I guess, quantify what's good and what's not?
That's very important for a residency program. We look for leaders. We look for innovators. So having life experience, having career experience, having professional experience is particularly important for us, because we want you using that experience. We want you contributing to the residency program using that experience. So definitely we want to know about it, and we want to make sure you highlight it on your personal statement and on your CV.
What about grades, GPA? Do you feel like grades are more important, or just kind of everything else?
Everybody's different. So for some people are really good test takers and have very good grades on standardized testing and USMLE and COMLEX, but may not have the best performance on their clinical rotations, and vice versa. Some people may do really well in their clinical rotations and not have the best grades. So I think it's important to look at the entire profile of what you have there. Definitely we want you doing well and doing your best. The better you do in rotations that have to do somewhat with emergency medicine, so like internal medicine, family medicine, pediatrics, surgery, we see that as something significant, right? That tells us a little bit more about how you work. And looking at your grades and your scores tells us a little bit more about how you do academically.